started my career in the Army back in 2007. I was 68 Whiskey as a combat medic, so I enlisted. I went here for my AIT. I graduated in August of 2007 from 68 Whiskey School, and then I went to Fort Bragg, North Carolina. I got to deploy twice with 82nd Airborne Division, got to jump out of planes, and then after that I decided to leave the Army and pursue my career on the civilian side as a registered nurse. So I worked as a ED and critical care nurse, that's emergency department and critical care ICU nurse, for about 6 years, and throughout that process I continued to serve in the Army Reserve as I was a staff sergeant, 68 Whiskey medic that entire time. But I was looking for an option to come back into the Army full-time, active duty, and also to pursue my career, advance my career as a nurse, taking it to the next level, being an advanced practice nurse. And I chose CRNA because I think, number one, it is probably the most competitive field for nursing, and it is also, it gets you the greatest opportunity to practice to the fullest extent of your nursing license. And getting to do that in the Army only brings that out even more. Yeah, so the Army program was my first and only choice for CRNA school. There's a lot of civilian CRNA schools out there, and I looked at a few of them and I considered applying for them, but the U.S. Army graduate program in anesthesia nursing is the only fully funded Doctor of Nursing practitioner program out there, and the U.S. Army program is specifically tailored at training you to be an autonomous, independent nurse anesthetist. So far it's been a great experience. So my wife and I moved down here to San Antonio in January. I went to a basic officer leadership course, and that was preceded by a direct commission course that was at Fort Sill, Oklahoma, and they paid for us to travel down here. They paid for us to relocate, us and our 2 cats. I'm getting BAH. It's almost $2,000 a month, so that fully covers all of my rent, all of my utilities, plus I get a stipend for books while I'm here in school, plus I get a stipend for food. That's a basic allowance for subsidy, and on top of that I get my base pay as a first lieutenant. Well, it's hard to tell because I haven't completed the program yet, but what I'm really hoping for is that I'm going to be more autonomous in my practice. I feel like how the school works is they train you to be safe and competent first and foremost, but their end goal for you is for you to be an autonomous practitioner, because if you deploy as a nurse anesthetist, there's a good chance there's not going to be an anesthesiologist for you to work under. So they really want to make sure that you're safe and competent, but also that you're going to be able to function and think autonomously so you can take care of soldiers and their loved ones. Normal day is usually I wake up about 5:15, go get a good workout in. I usually get to class around 7:30. They usually brief us some information, what we have coming up for that day or the next week, and then class usually starts right at 8 o'clock. It runs till 12:30 or 1. We do a quick lunch break, and then I'll usually stay there in the classroom or go to a library, get some study time in till around 4:35. Go home, eat, and then hang out with my wife, maybe go for another little run or walk, and then do some quick review before I go to bed, and then wake up the next day, start it all over again. If you are looking for more information or are curious about the U.S. Army's graduate program in anesthesia nursing, you can go to any of the available resources online. Thank you.